I'm Peggy Peck, MedPage Today. About 250,000 Americans are diagnosed with severe mitral regurgitation every year. Currently, the recommended standard of care treatment is surgery, either mechanical replacement or valve repair. However, a percutaneous approach using a clip, MitroClip, may in fact offer a different alternative, as we hear from Dr. Tom Feldman.
The eValve Everest trial, very much different than the other trials in this session, was a comparison of a first-in-class percutaneous therapy for mitral valve regurgitation with traditional mitral valve surgical repair or replacement. And the fundamental finding of the trial is that the safety of the percutaneous approach compared to traditional sternotomy, as you would expect, is much greater. The efficacy is statistically non-inferior, and the major conclusion of the trial is that with this balance between much greater safety and a small trade-off in efficacy, that for the right patients this adds a new choice to our armamentarium of therapy for this disease. That's particularly important because the majority of patients with mitral regurgitation who are really sick from the disease are never referred to a surgeon because of age or comorbidity.
My question is, when I looked at the data, I was struck by the fact that you had a 6% pre-specified difference for superiority. And I've talked to some surgeons, and they thought that one of their first comments was that that was a very low number to pick for that 6% difference. It was almost as if you did that, you knew for sure that you would show a really substantial and multifold difference.
I think the important finding is the fact that the actual safety difference between the two approaches is striking.
Mm-hmm. Striking, but based on that 6%.
Well, I'll reiterate, the real difference, you can look at the number, it's 6% versus 6% adverse, I'm sorry, 9.6% safety event rate versus a 57%. The observed difference is 47%.
Right.
Mm-hmm. To come to Dr. Feldman's defense, which I rarely do, I think the surgeon should focus on other critiques. That's just a bogus.
But a remaining safety issue, and one that was a bone of contention with surgeons, was a very high transfusion rate reported.
The importance of transfusions, I believe if you're a surgeon and you're accustomed to them, you don't think about it. The reality is the transfusions are not good for people. They are an adverse event. And we recognized at the end of the trial that as a pre-specified endpoint, we would probably have done better to have taken what the surgeons define as major bleeding. And with that definition, nothing changes. The safety difference is virtually the same. Certainly it remains highly statistically different. I'd point out also, and of course there wasn't time for this in the trial presentation, that the eValve, the MitroClip procedure, is one of the safest procedures that we have ever done in not only interventional cardiology, but in medicine. We have 1,100 patients worldwide treated. I believe the only procedure death was a patient who started in shock. There were no procedure deaths in the trial. And our uniform finding is that patients are more stable during this procedure than they are during anything else we do, PCI with stents or whatever. So I would also point out to you that while the surgeons may be focusing on the transfusions, we should all focus on the fact that there were zeros in the death, stroke, reoperation categories for this novel procedure.
So, interesting, pivotal data, but enough to convince the FDA? That much is not known. In Atlanta, at the ACC, I'm Peggy Peck, MedPage Today.